Hey there, I'm Dr. Jill Wener. I am a doctor, a meditation teacher, tapping instructor, a always aspiring anti-racist, which is a journey that requires constant attention and growing and learning. And I am so excited to have Jessica Brooks here with me on the show. She's the CEO and executive director of the Pittsburgh Business Group on Health, and so many other incredible organizations that we'll chat about during the episode. So I won't get into too much of that, but Jessica, thank you so much for being here with me today.
Thanks for having me. I'm excited also.
Awesome.
Really, it's been a pleasure to get to know you, and I'm really excited about your work.
All right, great. Well, also a shout out to our Dr. Tony Haley, MD, who is a common friend who connected us, who is herself an incredible woman, has been on the show previously. And yeah, so let's get started. So what you have, like a day job. You have your Pittsburgh Group on Health, Pittsburgh Business Group on Health, but you have so many other things that you do. You're just changing the world in so many ways. So I think what you do at the Pittsburgh Business Group on Health is super interesting, but maybe today we can talk a little bit about some of the other work you're doing in the anti-racist space and in the health arena to help increase equity. So talk about what you do.
Happy to. In addition to that, mother of four and wife, so at any time, just know you may get an experience of my full life here. So I'll actually talk about PBGH because the Pittsburgh Business Group on Health, known as PBGH as well, because it all connects. Everything that I do, I bring my full self into that, and my full self includes being a Black woman in America, right? So I've been leading the Pittsburgh Business Group on Health now for 7 years. We're a healthcare employer coalition. So our core mission is to coalesce and convene and engage employers to be the most empowered purchasers of healthcare, to transform healthcare in a way that's value-based, high quality, affordable, efficient, and transparent in a sustainable way that enables the largest purchaser of healthcare, which are employers, over 160 million lives, collectively, to continue to offer benefits and create an accountable healthcare system that actually works for the people. So that's what I do every single day. Coming into 2020, with all the unforeseen events that 2020 would offer, we in the Pittsburgh area had a report that came out, a race and gender equity report that the University of Pittsburgh, a sociologist and several researchers of the University of Pittsburgh conducted, which was commissioned by the city of Pittsburgh. And the outcomes of that report were staggering, not surprising to many of us in the Black community. However, to see it in black and white, to see the disparities in poverty, employment, income, education, and health being some of the worst in the country.
Wow.
And so the pay gap, some of the worst in the country. Black women in particular, it was basically an outcome of that was this is the worst place in America of any comparable city to be a Black woman and live in. And if you packed up your family, if I left today and moved to a comparable city, the likelihood of my quality of life increasing would be very high.
Wow.
And so that call to action was something that I could not be a Black woman leader of this organization and not, do something about. There's just no way that my silence would not be acceptable, and it would be harmful. And that's exactly the opposite of our mission at PBGH. So we honed in more on the health side of it, and the maternal mortality rates for Black women, our infant mortality rates significantly high, cancer for Black women, cardiovascular disease for Black men and women. You go down on several lists of chronic conditions and mortality and morbidity issues, and it was significantly different for Black people in this region. Mm-hmm. So we took that insight, brought it to my board of directors, and just painted the picture of we employ millions of people, or collectively our coalition covers 2 million lives, including employees and families. And if you have, you're in your office, you have your Black mom in a cube and she's 9 months pregnant, and your white mom in a cube next to her, same floor in Pittsburgh, the likelihood of your Black mom coming back alive is much less than your white mom coming back from maternity leave, and actually being able to have the opportunity of having maternity leave, right? Black mom may not come home and leave the hospital alive. Same benefits, we're paying the same amount. In fact, we're paying more for complications, we're paying more for death. And so, when you put it that way, they're like, no, that's not acceptable. But when I think of, as an employer doing benefits, I don't think of how I need to navigate that differently for my Black population, right? Or my white population. And this time that we're in, post George Floyd, has basically led credibility to our movement to come into this work of leading around health equity and focusing on it, with Black maternal mortality as a focus. So that's what one of the things coming into 2020, before the pandemic, before the murder of George Floyd, we at PBGH have been focused on how do we help the business community understand their responsibility in ensuring equity in health when they provide and spend billions of dollars on benefits collectively.
It's so important. I mean, it's such a huge industry, and it can be, I can imagine it can be molded in so many different ways. And if you don't have someone socially responsible or an organization responsibly molding it, I can see it being, it already has the potential, or can be very harmful. So it's the work that you all are doing is amazing. And I wonder if you'd be willing to share your story that you told on the panel. I know PBGH has done a series of panels about racism in healthcare, and you shared your own experience when you were giving birth. Is that something you feel comfortable sharing here in terms of making this really real for the people who listen?
Yeah, sure. I'd be happy to. And actually, the panel was, so PBGH is a member of the National Alliance of Healthcare Purchaser Coalitions, which are coalitions across the country. And so the National Alliance, which I sit on the board of, has been leading these race, health, and equity town halls, which Jill, you were a part of. And thank you for being a part of that. So I've been asked to help lead it. For a variety of reasons, because I've been speaking on this and we came in already with this on our agenda prior to the pandemic and seeing the disparities around that, but also because I'm the only Black coalition leader across the country that, is a member of the National Alliance. Mm-hmm. And so I have a unique and obviously a direct voice in this. And so anyway, yeah, so that's kind of what we've been doing and responding and being very responsive, which I'm very proud of. And I've been sharing my story around my birthing experiences for about 3 years, right? So it was kind of like this brave thing. I was asked by someone I had hired to help me with my speaking, and she had me dig a little deeper as to why I even lead the coalition. Like, why is it important for me to be in healthcare? And what were my earlier experiences that kind of shaped my passion around it. Mm-hmm. And so she made me kind of like break down. It felt like a therapy session, and I kind of went through some of my experiences. And my most defining and significant moments in my life was, when I was 24, I found out I was pregnant, and I was working for a defense contractor away from my family, out of state, and it was scary. It was just, I was a single mom at the time. That was just a big, big change in my life. I just started my career after graduating from school. And, but at the same time, it was the most important thing in my life that was happening. And so my care experience throughout that time was not very comfortable. I felt a level of like, I was another statistic walking through the door every time I went to the doctor's office, and how I was treated, kind of the air, even from like getting your insurance cards at the receptionist desk, and not necessarily being listened to when I shared certain things. But, I kind of brushed it off. It was my first time. I didn't know if it was normal or abnormal, but I felt it. It was a feeling, but something I couldn't really pinpoint. And then I was on my due date. It was really important for me in my life to have a natural birth if I could. My sister had had previous C-sections, and it was important for me to be able to have my baby natural if I could.
Mm-hmm.
And so when I was told on my last appointment, on my due date, that I needed to go be induced because my blood pressure was slightly elevated, I couldn't wait another day and I had to go in that night, it was devastating. So I went in that night because I knew enough, although I wasn't in healthcare yet, I was in defense. I knew my health literacy was to the point where I knew that inductions could lead to a C-section at a higher rate than not being induced, right? So I was just, emotionally distraught about the outcomes of my care plan and being followed through. So nonetheless, after 13 hours of labor, no meds, induced labor, I was told, hey, nothing's going to happen, and you'll be able to, you have to go have a C-section, basically. There's no choice. Like, this isn't going to happen for you. And so brought into that room, and ultimately, once they numbed me, they strapped my arms down to the bed. I'm vomiting, my blood pressure's dropping. Basically, all I hear my sister saying is she dying. And I never heard a response back to her. But next thing you know, my Jesse was there, and he was alive, and so was I. After that, the treatment that I received in the hospital was not great at all. I was being blamed for my baby losing weight when I was trying to nurse him. So my thing was, it was important for me. If I couldn't have him natural, but at least let me, I want to be able to nurse. I want to be able to do that. Yeah, it was important to me, and very, very basically mean to me. And I ended up leaving there basically depressed. I've suffered through postpartum depression, and I attribute a lot of that through the experience that I had, especially postpartum right before. And then I've learned, oh, wait, it's natural for the babies to lose 10% of their body weight. But I was being told that I was doing it. I was killing them. And it just did something to me. So that was one treatment experience. My last birthing experience with the last child, I have 4. So each one has had their series of trauma in my delivery experience. But so the last one, I came in already really, just nervous. I knew it had to be a C-section. And I was told, and I was pretty hysterical as they were trying to numb me. And I was told by the anesthesiologist that I had once before that she believed I had post-traumatic stress disorder right before they even numbed me. And then she left and told my husband that she believed I had post-traumatic stress disorder. And then I never heard from them again. I mean, I had my baby, but to get a diagnosis like that and then to never be followed up with after delivery have been a couple of the experiences that I've had through my birthing experience. In the middle of that, I was asked with my third child, you didn't know I had this many stories, that if my husband was the father of my first child. And I was like, it was in a regular doctor's appointment, just like my 6-month checkup. And, doctors rotate, so you get different ones. And this doctor asked if my child was, if Marlon, my husband, was the father of all my children. And I said, well, what does that have to do with anything? And then she gave me this answer, like, oh, it matters biologically. It could have, this information that's important for us to know. And so, I still haven't gotten proof of that. But so I've asked my counterparts, and no one else has been asked that, my white friends. So anyway, those are a couple of examples.
Yeah. And that's like, you're like super well educated, powerful, high performing, all the things, but still, and that's one of the things with the data is that it's shown that this maternal mortality and poor outcomes, it goes across all classes, all socioeconomic levels. It's not just people who don't have insurance or something like that, which is also really telling, I think.
It is. It's a really important point because especially me serving employers, they need to know this isn't Jessica Brooks' issue. This is an employee of your issue. This isn't, the Medicaid health plan issue that's, and the assumptions that you have that come with that population, which is completely ridiculous and racist. But nonetheless, this is your issue. And I do think it's an important message that, yeah, your friend Jessica is facing the same things as the person you walk past in the grocery store or your cashier. I have the risk of dying in Pittsburgh or across this country, because this isn't a Pittsburgh issue. We have a country maternal mortality issue, that this doesn't, my income and my education won't save me.
Yes, yes. And it's so powerful. And I think hearing your story, it's so easy in this world, particularly with racism. It's so easy to point the finger at other people, at other systems, at other classes, at other races, at other anything else, then take the responsibility yourself. But hearing a story like you're an executive at this huge company and it happened to you three, you mentioned for 3 of your pregnancies. I would not be surprised if it was all 4 of them. And that's just during pregnancy, much less all the other times in life that Black people are facing different treatment.
Yes, I a real quick story. My son, who's 13, he was 11 at the time, went to his pediatrician, and the pediatrician said, hey, this is the age we kind of take them, away from parents and check them out, have more private conversations. But if either one of you want to come, please do. So my husband went, and they checked him and started talking to him about social issues and pressures, and asked him about marijuana. It was, do you smoke? Have you ever been asked to smoke marijuana? And my son said, well, what's that? And the doctor said, that's a drug that Black kids take. So I didn't learn about this until after we left the doctor's office. And but I made a call afterwards and had to educate that doctor. But that's another example.
Wow. That's just like, you can't.
And my son didn't even know what it was.
Right.
So anyway.
Yeah. So there's so much there. So thank you for sharing those stories. And I love how that, I didn't realize that it tied in with the training you were doing for speaking. I think and that helped you connect to that. And then I think that makes the message be received in so much more powerful way when it does come from personal experience like that. And it's too bad that you have to go to that level for it to be heard, but I think also it's effective on several levels. And I think, from the white person perspective, they're probably proud of themselves for like not assuming that you're married and not assuming that like I've been in situations where it's like, oh, well, does your husband this? And it's like, why are you assuming I'm married? And that could be for any race, but I think there's just this lag of understanding. There's generally some sort of intention that's good, but then it's like overcorrecting and then being like, all people from this certain race or this class or this background are going to be like this, and not understanding how to talk to people and, I don't know, maybe show how down they are or something. There's so much education that needs to be done, and there's so much that people need to do to actually put themselves in someone else's position rather than making their own assumptions and judgments.
Correct. Yeah. And I think that's our responsibility too, to take those moments. I could have left that doctor and my husband and would have moved on and scheduled another appointment in a year. But I had to call him. I had to have that conversation that you're wrong. Here's actually statistics that say that it's not a Black drug issue. I've actually, was in Denver with a lot of my colleagues, and they didn't look like me, and they were having a good time, right? So,
I mean, I've never, but no, of course I have, and everyone I know has. It's not
right. Yeah. So there is an opportunity to do that, and that's what we're doing.
How did he respond, by the way? I think you said it was a male doctor.
He apologized. Okay. He apologized, but he did at first. He really believed what he said. And he was kind of giving me what he said was true. And I said, that's not true. And you just put something in my son's conscious and subconscious that wasn't there.
Yeah.
You actually caused damage. You introduced marijuana to him, not the kids at his school.
Right.
Yeah. So he apologized.
After a while, it sounds like, but at least, yeah. And that's another thing that's tough too. It's like, if correction isn't happening, people don't know to do better, but how much emotional tax do you have to pay in that?
Over and over and over. Yeah.
Yeah. Cause I mean, I every time I correct people, I would say 30% of the time it's received like super well, and 70% of the time there's a lot of pushback and defensiveness. And that's for my own white self, not having to have lived this entire lifetime of racial trauma. So that emotional vulnerability that you put out there, how do you keep going back? I guess, what does it take for you to keep having the strength to do that? Because I can't imagine having to correct that after all the marginalization and all of the mistreatment, then having to speak up and maybe get yelled at.
It's survival.
Yeah.
So, just like animal instinct, you do what you have to do to survive.
Yeah.
And that's a part of survival. That's a part of getting from survival to thriving. And I'm a strong woman of faith. I definitely lean on my faith and God for restoration and peace and direction around it. But I live my life in the way of purpose. And so the true, beyond just being a citizen and a community member and a neighbor, my profession, I ensure, integrates this work because it's key. It's directly aligned.
Yeah.
And my community work that I do is, I bring that perspective to it. So where I've been blessed to have platforms and to be able to help influence organizations that touch people, I do it in that way. And in that way, it's fulfilling and not just draining.
Right.
So, but it's hard. It's survival. I don't feel like I have a choice to do that work and to have these conversations and the compounding effect. With that said, being close, I'm not a clinician, but I do know that has effect on my life. I know that has an effect on my life expectancy. That the stress and even gearing up to have the conversation is doing something internally that will have an effect. And so being aware of that consciously makes it tough sometimes because keeping it in eats you, and then exerting the energy to kind of confront it also, creates maybe some health outcomes that, could come up at some point in time, right? So trying to be as holistic in my life to manage that with my spiritual well-being as well as my physical well-being is a key part of that.
It's so important. And I did an interview with a woman named Crystal McCreary, and I talk about this all the time, but she's a yoga and mindfulness educator in New York. And she was quoting someone else, but I'll just quote the way she said it to me because she couldn't remember exactly where she heard it from. And it's kind of like not just one person said it, but for white people to think about, whenever you lean into your discomfort, particularly about race, that frees up the space for someone else to pull away from their discomfort. So I think it's such a beautiful way to think about it. Like, oh, does it hurt you? Does it make you, guess what? Like, Black and Indigenous people in this country have that all day, every day. So you can share some of that burden by leaning into that discomfort, and that frees up. Think of it in an altruistic way if you'd like to. You taking on that energy takes it away from someone else. And as you're saying, I mean, the health outcomes of chronic inflammation and being chronically in stress mode, that's really bad. That causes chronic inflammation. That causes more obesity and diabetes and COVID bad outcomes. There's so much that, excuse me, that it directly impacts. It's not just emotionally stressful. It actually has physical impacts down the line. Excuse me. So on that note, talk to me about Earn. I'd love to hear more about that work that you're doing and the help
Sure.
desk, either one or both.
Okay, so EARN is a new organization that I've co-founded with two other founders. It's called the Executive Action Response Network, and it was birthed out of the time that we're in, post George Floyd. Several of my co-founders and I were in an executive leadership program together at Carnegie Mellon for Black executives, and ultimately the mission of that program is to change the trajectory of leadership in the Pittsburgh region to be more inclusive and to elevate Black executives. So we've known each other and had gone through that program last year, and then we started just talking more and more during this time, and really felt that it was necessary to have the Black leadership perspective shared in our region. We have less than 1% Black executives in this region. And we felt that the senior leadership, upper middle management, voice is typically silent during this time. George Floyd isn't our first murder, right? And we had Antoine Rose, unfortunately, a young kid in our region last year, and we have many other names that I can definitely list, right? And overall in this country, we haven't had the Black leadership voice at the table. So we came together and we created EARN. And EARN is designed to, one, have that voice at the table, respond to the reaction that corporate America has had as far as engaging their Black workforce and really expecting their Black workforce to come up with the solutions to the problems that they frankly didn't exist in the institutions they didn't create. Commit to statements and commit to multi-million-dollar and even billion-dollar investments in Black communities. And with that said, we had this culmination in Pittsburgh where we had that report that I mentioned to you. Then we had the pandemic and the disparities that were called out around Black people contracting the virus at higher rates, Black people dying at higher rates. And then we had the murder of George Floyd. And while we're seeing our young people, for the most part, out there on the front lines, protesting, getting rubber bullets thrown at them, really fighting for their lives, essentially, the future that they're not willing to accept. They want to create a new one. They want a different one that many of us have contributed to and ready to inherit, pass down to them. They're not willing to accept it. And so EARN is saying, we're not willing to accept it. We're in your institutions. We have a voice. We are valued. We're undervalued. And here's some strategies, some concrete things that you can do, institutions, to do something about it. And why corporate America is because they are a microcosm of racism. Their institutions have policies, procedures, and practices that, kind of feed the beast of institutional racism. Mm-hmm. And acknowledging that is key, but doing something about that is even more important. So, we have sent a letter to our leadership in this region. We also expect to send letters to the board of directors, board chairs of major corporations in our region. We are looking for increased acknowledgement of this, that we have a framework that we've developed that incorporates anti-racism training that we're promoting throughout the organizations, partnership around talent acquisition for key strategic roles of Black executives, increasing their supplier diversity spend. We have multi-billion-dollar budgets for supplier diversity with less than 3%, in many cases 5% going to African-American businesses. We want that to change and increase that in a short amount of time. We need tangible changes with the idea that we are professionals. We have business acumen. We have strategy, strategic skills. We have relationships, and we can help these institutions, those that are really willing to do what is necessary. We also want to support our Black colleagues. Our diversity and inclusion professionals, not all of them are Black, but many of them are Black professionals who have limited resources, limited staff, very limited commitment. Up until now, they weren't even expected to address racism. And now they are expected to be the answer and have the strategies and everything rolled out. Exactly, check the box. And so we're saying they need the support. And there's some things that your Black colleagues can't say in your institution that we as a third party that represents them, their voices, that incorporates their voices into these next steps, we can provide you, right? There's little risk to us as a third party, but for your colleagues, if you expect them to really be transparent with you when you can fire them, not promote them, apply even, harsher glass ceiling on them, that's unrealistic if you expect that. So we want to be a resource to our region. We want a better future for us as professionals, but we also want a better future for our kids and the next generation. And so that's what EARN is about.
And how have you been getting the word out? Like what have you?
Yes, so we have gotten we sent the information. We hired a communications firm to help us get the word out. And so locally, so far, the Tribune, Trib Live has picked up the story. Next, Pittsburgh Business Times. We have other calls every day for folks who want to interview us, radio stations, and then our networks nationally. So we have others who have relationships with other publications across the country, national publications. So many folks are getting the word out there in our network. So we started with our Black network across the region. We thought that was important for them to know what we were doing, give them a heads up, get their support, and let them know that their CEOs would be receiving these letters from EARN. And so that's pretty much, and very quickly, the word of mouth is spread. People are talking about it in their boardrooms, in their amongst their circles. The responses have been interesting, Jill. I heard from a variety of colleagues, Black colleagues and professionals in the region, that they felt the letter and the language in the letter was very strong, too strong. We should, we don't want to basically scare our white leaders, that we need their help and we need them to continue to support our initiatives in the region, to continue to regard us as colleagues, and that the language in the letter could basically have caused them to say, you know what, no, we're not taking any demands. You got our statements and our $1 million commitments to organizations. Stop asking for stuff, and we're not helping you. In fact, we're going to take back what we already promised you.
Yeah.
And so the pressure that it really spoke to the pressure that Black professionals feel in the organization. I heard a lot of fear, a lot of concern for retaliation in some kind of way from our white leadership, our white executives in our region. And so it's been although not surprising, I can tell you it has been disheartening to hear that concern for fear, for livelihood, for loss of income, there's a lot with that. And that tells me, and it should tell our region, our nation, the responsibility that these corporations that benefit from our intellectual property, that benefit from our sweat equity, that benefit from everything that we provide, our dollar as customers, have a responsibility to respond and assure that by having a voice as a Black person, you will not be retaliated against. And in fact, putting action to that by taking on some of the recommendations that we put out there.
Yeah, there's so much in that, because there's so much of racism. I think what a lot of white people don't realize is that as this racism is so systemic, it's in the air, it's in the water, it's in everything, it gets internalized by everyone. And so there's this fear of don't upset the beast being the white power, the white supremacy and for anyone listening who hasn't heard the term white supremacy culture, I'm not talking about people in the KKK. That is intentional white supremacy, but white supremacy is kind of I also heard white body supremacy recently from Resma Menachem, I think is how you pronounce his last name. It's the way that our culture is designed to keep white bodies in a position of power. So it gets internalized, and there's this I've made it maybe, and I'm not Black, obviously, so I can't say for sure, but it's I've gotten this far this is a dangerous place for me to be if there is retribution or if there's backlash.
Yes.
And I could lose, like you were saying, I could lose my job. And like, maybe if we're just nicer about it, and people have suggested to me as well, like my whole curriculum and the name of this podcast is conscious anti-racism. People didn't know what anti-racism even meant a few months ago. And it was like, I felt this pressure to make it sort of more palatable, but that's the opposite of what we want to do, but it's a balance. There's like a push and pull with it.
It is. I mean, you don't want to scare people away, but this time has to be different.
Yeah.
This time has to be different. You know, where COVID and being home and being more present met, 8 minutes and 46 seconds on a Black man's neck by a police officer, we cannot possibly think that our language and the way we approached and our strategies and our appeasement and our, fragility has the same consideration. That moment called for something great, very different.
Yeah.
And so, yes, language is more direct. The storytelling is necessary. The accountability, the call for transparency, you can't forget this moment. We're not going to allow that because you shouldn't, right? This is about well-doing so that we can have a well-being.
Yeah.
And that's what this is about. And I think, if our white colleagues realize that we'll work with them in it, which Earn is all prepared to do, and I think, and your work is prepared to do, that we can get it done. But their commitment is necessary for that. And so that's what we're asking for.
Yeah, that's great. I'm glad you've had such a good response. And I think always, if you're not ruffling some feathers, you're not doing enough, and you're not pushing you've got to push some buttons to actually make change. So I think that's also important to note. I love so much that you've said. I'm like writing down all of your your quotes here, because I think you've said so many insightful things. What takeaway do you want people to have listening to this episode of this podcast? Whether it's white people, whether it's Black people, what do you think is important for people to know about this moment?
I really encourage everyone to do their own self-audits, and that goes across race, age, profession. Look at your own do your own self-audit. Who are you sitting your money with? Who are you promoting? Are they aligned with this work of equity for everyone? Are they aligned with being anti-racist or very conscious of their bias? Are they taking action in their own businesses and their own networks to do the same? And adjust when you find out the truth. If you know that you're working with a supplier and you're a corporation, and they're not aligned with your values in this work, then they need to go. There's a vendor that can supply that is aligned with you, right? Be very clear on who you want to align with, and make that show in how you spend your money and your time and your resources. So that's a call to action I think we can all take. Is our own self-audits and being clear about that. And we're all different. So you're going to do it in a very different way than I'm going to do it, but that doesn't mean that you shouldn't do it.
Right. And even thinking about your own network, like if you need an attorney, don't ask your white friend, because they're going to most likely going to refer a white attorney to you, but ask if there's a attorney of color, a Black attorney that you could work with, or, you have to be explicit about it. You have to be intentional about it, because otherwise.
Exactly. Otherwise, you'll go back into your habits. We're people, you're creatures of habits, right? So the intentionality of our way forward is going to be the differentiator.
Yeah, that's so important. That's so important. Thank you so much. All right. Well, Jessica, thank you so much. Jessica Brooks, the CEO and Executive Director of the Pittsburgh Business Group on Health, She started the EARN organization, the help desk. There's so much we didn't get into. Maybe we'll have to do a whole second episode, but there's so much work you're doing in terms of patient advocacy in the healthcare system. But you were doing so much to make the world a better place. And I am very grateful to know you and have gotten connected to you, and look forward to seeing what comes next for you.
Same here. Thank you so much.
All right. Thank you.